Welcome to the Fascia-Informed Therapist, the essential podcast for occupational therapy professionals looking to deepen their understanding of fascia's pivotal role in therapy and health. I'm your host, Amy Mayer, an experienced occupational therapist, practice owner, and dedicated educator. Here we'll dive into the fascinating world of fascia, exploring its significance in the human body and its critical influence on occupational therapy practice. Each episode will bring you cutting-edge insights, expert interviews, and practical strategies to help you confidently integrate the science of fascia into your therapeutic approach. Whether you're a seasoned practitioner or just starting out, our goal is to equip you with high-quality, evidence-based, and fascia-informed continuing education opportunities that will enhance your skills and benefit your clients. So join us as we unravel the complexities of fascia and transform the way you practice occupational therapy. All health and wellness practitioners are welcome. Let's learn, grow, and evolve together. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. And I'm kind of doing an impromptu recording today, but I decided to do a video because why not? I'm playing with some of the tools that I have on my my software that I use to record my podcasts, and it will also do video. So rather than setting up my extra video equipment, I'm just going to use what I have. And I also decided I'm not going to do my hair today. I'm not going to put on makeup, and it's cold in here, so I'm going to wear my nice Creighton gear sweater here this morning that's super warm and comfy. We're supposed to get lots of drizzle, some snow, some ice today and tomorrow, so it's a good day to stay inside and read some studies, right? So I was actually looking for what's the latest and the greatest in the area of cancer, post-cancer treatment, and what we can do in terms of fascia-informed techniques to help those folks. I was contacted by a therapist who is having some overflow in the work that she does, working with post-cancer patients in her outpatient practice, and is bringing another therapist in to help her. So they contacted me and asked me if I would put together a little session for them to help refine their technique. And I'm super excited about it because these women, they're both occupational therapists, are the experts in post-cancer care, specifically head, neck, and breast cancer. They're the experts in there. I'm the expert in the science and the technique, in this case anyway. And we're gonna blend what we know together and learn together, really. But they just really want to refine their technique so that they can apply the technique in the way that they know best. So this is like my dream job. It's like my dream job to be able to do that with these experts. Anyway, so as I was looking for these studies, I came across this other study that I thought, oh my gosh, I gotta talk about this, because my mission, as many of you know, is to get the science of fascia into more therapists' hands that practice in traditional settings. And not necessarily just myofascial release, but knowing the science of fascia and then critically thinking about it, and then choosing the techniques that are most appropriate for your setting and applying them there. And I get it with today's the reimbursement issues that are out there, the lack of time that you have to spend with your clients. But I think that knowing some fascia-informed techniques, some fascia-targeting techniques, is worth your time, because you do other manual therapy techniques, most likely. So why not add this one to your toolbox? Why not add fascia targeting techniques to your toolbox? Because you may not be able to spend the amount of time doing techniques with a client that I can spend in my practice. However, I think it's important that you consider, as more and more science comes out on the fascial system and more people are being exposed to it, understanding it, seeking it out, at least being able to educate your clients about it, giving them the opportunity to experience it in a traditional setting so that maybe they will then seek it out in a setting that maybe isn't as confined to the same the progress that you need to show. We can go slower, we can spend more time. And anyway, so that's my case that I want everybody to think about in terms of this. So here's the study that I found, and it's a 2024 study. Let me see if I can, September of 2024. So very recent, and it's called A Review of the Application of Myofascial Release Therapy in the Treatment of Diseases. So that's pretty broad. This was actually a study that came out of China, the Chinese Medical University, and they look at several different diagnoses or disease processes that I will review for you, but they cite 97 different studies in this article, and the 97 studies that they cite are studies from all over the world, which is pretty cool. This study was published in the Journal of Multidisciplinary Healthcare, which is an open access to scientific and medical research journal by Dove Press. So they define myofascial release therapy as applying sustained pressure to the myofascial tissues to release tension, reduce pain, and improve function. And I want to be clear that they don't say we're only gathering studies that do a specific technique, like myofascial induction or the Stecco approach or the Barnes approach. That is not what they did. They're any myofascial, something labeled myofascial that involves sustained pressure to the myofascial tissues to release tension, reduce pain, or improve function. Okay, so they also go on in the first part of the introduction of the study to talk about the difference between trigger points and tender points, and I'm going to just read a little bit to you. Tense myofascial areas may form pain-sensitive points to the myofascia, which are often referred to as trigger points or tender points. It's important to note that these two phenomena are distinct. The etiology and pathophysiology of myofascial trigger points and tender points differ, with trigger points typically associated with palpable nodules within taut bands of skeletal muscles, and the tender points being more diffuse, tender, without a clear nodular structure. And I would say definitely see both in practice. You can have areas that are just super tight and feel restricted, but you can't necessarily feel a specific trigger point. And then there's many times where you can. I was actually working with a student yesterday on trying to feel the difference between widespread tight areas and trigger points, and she was darn good at it. Caitlin's been working with her most, so she's doing great. Okay, so the first, they talk about chronic pain, and then they talk about chronic low back pain. So they start with low back pain, likely because that is huge. And they say that it's increasing so much that now and they specifically comment, and I highlighted some things I wanted to share, that it's increasing in young populations. And I would definitely agree with that. And I'm sure I've said in other podcasts that I have worked with, I haven't seen a lot of teens lately, but in the last couple of years, I was surprised how many teens were showing up with things like disc bulges and just generalized low back pain. I mean, that's not something that young people are supposed to have, but there's a lot of reasons for that, but we won't go down that path right now. And then they also say, and they're citing lots of research that they're citing as they go through here. So 90% of low back pain is considered to be non-specific low back pain. A systematic review reported 6 randomized controlled studies on the use of myofascial release in chronic low back pain through screening. And the results showed that 397 low back pain patients aged 18 to 60 years could effectively relieve the pain of patients, promote increased patients' range of motion, and improve the physical function of patients after myofascial release. Now, I did notice that there is some awkward sentences in the translation, likely of one language to another. So if I'm stumbling, it's because I'm trying not to make it awkward. Okay, so, and then another section in the low back pain that I highlighted, the application of myofascial release in chronic low back pain can not only reduce the degree of pain, but also greatly improve the quality of life of patients and improve their mood. However, in the course of treatment, appropriate treatment options should also be developed according to the actual situation of patients to achieve the best therapeutic effect. And absolutely, and that's I think a really important point, is that everybody is going to be different, and the overall course of treatment, yes, needs to be developed, as they say, to the actual situation of patients, but we know everybody needs to be treated as an individual, and that every problem is a whole body problem, and we need to look at why did they develop this back pain in the first place. And it could be anything from stress to poor ergonomics at work, a lifting or moving injury, or posture. Could be a lot of things. The way that they're doing their exercise, maybe they're not doing their exercise appropriately or with the best possible form. We have to look at everything. Maybe it's the way they stand. Maybe it's the way, I could go on and on and on and on there. But I think what they're saying here is that myofascial release can relieve some of that pain, because I've seen over and over and over again where people stop moving, they stop exercising, they go into protective postures, and things just get tighter and tighter and tighter, and the pain gets worse. And if we can relieve the pain, teach them better posture, and get them moving again, then that's going to set them on a course for a much better outcome. So myofascial work can definitely be a part of that, and I think the studies that they're citing, and there's a whole lot of them in this section, help to support that. The next that they talk about is chronic pelvic pain, and this isn't an area that I don't do internal work in my practice, in that area of the body anyway. But I do. When people have contacted me in the past and asked if I do that, and I say don't, but you can get a lot of relief. And I have worked with women with pelvic issues, but we work in the abdomen, we work in the adductors, we work on the glutes, and you can get a lot of relief without going internal. But I also have sent many women on to work with someone who does internal work, because I do believe that it's important. And, I don't know why I don't do it. I just haven't, and I've got plenty of work to do without going in that direction. So, and there's people who do it that I can send people to. The next one is fibromyalgia, and that is a huge, I think a huge problem that's just getting worse. Myofascial release can help patients with fibromyalgia relieve muscle pain and stiffness by improving muscle and fascial tension. It can be achieved by massage, manipulation, tools, and other means of therapy. Let's see. They assessed the effectiveness of fascial release for fibromyalgia from the indicators of days patients felt good, absence from work, workability, stiffness, and pain. It's certain that fascial release can effectively relieve the pain of patients with fibromyalgia, can improve the quality of life of patients with fibromyalgia, so that patients with fibromyalgia can better invest in life and work. And I have had many patients with, I don't call them patients, I call them clients. I don't know why I said that. I suppose because I just read that. I call them clients because I see what I do as very collaborative, and I wrote a blog about this once. Patience just comes with a kind of a stigma of, you are the expert, I am the passive person in this relationship, fix me. A client feels far more collaborative to me. So I have had many clients with fibromyalgia. Most of them have experienced a lot of relief. However, well, let me say this first. I did have one person that came with fibromyalgia at the recommendation of another client, and after the first session, it stirred her up badly, very bad. And she wasn't angry really or upset, but she did make it clear to me that she was never coming back. And I encouraged her to reconsider, because I mean, that happens when you start to open somebody up. Things are changing, things are moving, but she wasn't interested in that. And there's a lot of potential reasons somebody might get really stirred up, and there's a lot of reasons why someone might not choose to come back. Anyway, I still think about her, and I hope she's doing okay. The next section they talk about is sports injury recovery. And they say here, sports injury refers to a condition in which the body tissues are damaged or function is limited during exercise. These injuries can occur in tissues such as the skeletal muscles, joints, ligaments, tendons, cartilage, and are usually caused by overuse, postural errors, poor exercise techniques, poor environmental conditions, or the influence of external forces. So it sounds to me like they're not just talking about people who engage in sports, but also people who engage in exercise. Myofascial release is commonly used for chronic sports injuries. And when they say commonly used, I don't know if they're talking about how they use myofascial techniques in China, or if they're referring to all over the world. But I don't know that I would say, they say commonly used frequently in here, but I don't know that that's really true here in the United States anyway. Myofascial release helps reduce muscle tension and pain by releasing the muscles and fascia of the body by manipulation or tools. During recovery from sports injuries, myofascial release can help relax tense muscles, promote rehabilitation, and reduce pain. Several studies have shown that myofascial release can effectively improve flexibility of muscles and thus improve the athletic ability after the end of exercise. Myofascial release contributes to the physical recovery after exercise while increasing aerobic capacity and flexibility. Myofascial release can enhance athletes' strength. And I thought, wow, that's interesting. I'd like to go drill down on that a little bit, but I'm assuming it's because if you can access more range of motion, you create a longer lever arm, which allows you to create potentially more power. Let's see, the results of Rahimi et al. Showed that myofascial release helps athletes to play better on the second and third day of competitions. I thought that was really interesting. Well, the detection of lactate content in the blood also verified this conclusion that myofascial release helped athletes to decompose lactate in the body after competition and accelerated athletes' physical status recovery. So very, very interesting. That's a pretty big section splashed with a ton of references. And then the next section they talk about is headache. And I'm going to skip down to the bottom. This is a fairly long section too. Myofascial release improves blood flow to the brain, and parasympathetic stimulation treats headache by secreting vasodilator neurotransmitters or reducing pressure on the internal carotid artery and vertebral artery by external tissues. In the treatment of tension headache, myofascial release has also been found to work well as a pharmacological treatment and is effective in relieving headache symptoms in patients. In summary, myofascial release can play a role in the treatment of headache, helping to relieve headache symptoms and headache frequency and improve the quality of life of patients. And I definitely have seen that play out in my practice. Headache is a fairly common concern of a lot of the clients that end up working with us, and it definitely tends to bring the frequency down. But again, you have to look at the whole picture. When you just do a myofascial technique, but you're not looking at their posture or their habits or their stress levels, all those things, you're just kind of sending them back out into the wild, building up the tension that they built up that may have caused the headache. It depends on the type of headache. I get that. But if it's tension headache, you're sending them back out there into the same stuff that got them there in the first place. So that's why we really surround our technique with a lot of what is really going on with them. What is the real root cause? Because if you think of, the root cause is the fascia, well, yes, if we address the fascia, then we're going to help people, right? But what made the fascia tight in the first place? It can be anything from stress, it could be nutrition, hydration, it could be posture, it could be how they move, it could be a lot of different things, it could be many of those things in combination. So if you really want to get at the root cause, you're going to look further and deeper, and you can help them more and get them better faster and less reliant on us who do myofascial technique. Okay, here's a good one for all of you traditional therapists out there, traditionally practicing therapists. Stroke patient recovery. Interesting, right? According to a study by Dengiz and Bascan, cervical mobilization as part of myofascial release therapy led to a significant improvement in balance and gait patterns in individuals recovering from stroke. These findings suggest that targeted myofascial interventions can play a crucial role in enhancing post-stroke recovery and overall rehabilitation outcomes. Myofascial release can be used as part of rehabilitation for stroke patients to help stroke patients reduce muscle spasms, improve motor function, increase joint range of motion, and promote rehabilitation. The release of these myofascial restrictions can improve motor function and balance, facilitating better rehabilitation outcomes. A report by Parikh et al. Showed that patients with chronic stroke, the use of myofascial release with a tennis ball improved muscle spasms, improved the function of upper limb movement, contributed to the recovery of physical function in stroke patients compared with conventional physical therapy. So that sounds like you're teaching them self-treatment, and that is helping them a lot. So yes, I would love for every therapist out there to take our self-treatment class, because that is, if that's not patient empowerment, I don't know what is. And then what I was looking for in the first place is the section on cancer pain. That's what I was out in PubMed looking for. Myofascial release has also been used in cancer pain. The most widely used is cancer. Myofascial release has also been used in cancer pain, and the most widely used is cancer pain treatment in breast cancer patients. Okay, now I'm going to read you this kind of long section here. Myofascial release belongs to the category of manual therapy and is a low-impact, long-term treatment designed to restore the length of fascia, eliminate functional limitations, reduce pain, and improve the function of the motor system. In the context of breast cancer-related pain, fascial technique targets myofascial tissues in the pectoral muscles, particularly in the pectoralis major and minor, as well as the upper trapezius. Now, when I treat people post breast cancer, we go a lot more places than just that. These muscles often develop tightness and trigger points due to post-surgical adhesions and radiation therapy, leading to shoulder and chest pain. Several studies have reported the efficiency of efficacy of myofascial release in relieving cancer pain in patients after breast cancer surgery. De Graaf et al. Showed that the use of myofascial release was effective in relieving the degree of persistent arm pain after treatment in breast cancer patients and contributed to the recovery of patients' post-operative upper limb ability. Eduardo Castro-Martin et al. Showed that myofascial release was effective in relieving neck and shoulder pain in breast cancer patients by randomizing a single-blind, placebo-controlled group. The study by Massengill et al. Yielded the same findings. However, some studies suggest that myofascial release has no significant efficacy in relieving cancer pain in patients compared with drug efficacy, which may be related to the number of samples in the drugs used. Overall, the use of myofascial release helps to relieve cancer pain and improve physical function in breast cancer patients. And let me just look and see. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 studies cited in this particular section. And I'm going to drill down on some of those in my preparation for working with these experts. So anyway, I thought this study was very, very interesting. That's the next section is their conclusion, and they're basically saying that it's really something, myofascial therapy, again, any therapy that applies continuous, slow pressure stretching to relieve pain in patients should be looked at more seriously in terms of using it with at least the populations, the problems that they discussed in this study. And there's a lot out there, and it's sometimes hard to get your hands on these studies. And if you don't know the science, it's hard to understand maybe why it works. And I guess this is the last time I'll say in this episode anyway, pay attention, learn the science. It's part of the human body. And when you know it, you'll start applying it to yourself, as well as your family and your friends, and then also your clients. So thank you, as always, for listening. I am very grateful for all of you. And I don't think I said in the last one, we did surpass 2,000 downloads. I now have it uploading to YouTube as well. So just continuing to try to reach more and more people, especially practitioners. Thank you so much. Thank you for tuning in to the Fascia-Informed Therapist. It's been a pleasure sharing insights and strategies to help you integrate fascia science into your practice. I'm Amy Mayer, and I hope today's episode has inspired you to explore further and take your therapeutic skills to the next level. Remember, we're committed to creating and providing top-notch, evidence-based, fascia-informed continuing education that empowers you as an occupational therapy practitioner. Stay connected with us for more enriching content, and don't forget to check out our online courses to deepen your expertise. Until next time, keep expanding your knowledge, refining your skills, and confidently applying the science of fascia to your practice. Here's to advancing together in health and wellness.